Hi, I'm Dr. Picard, and today we're going to talk about thyroid disease. So, some of the symptoms of thyroid disease are fatigue, weight gain, hair loss, constipation, elevated cholesterol, depression, anxiety, inability to concentrate. And these are just a few things that people might experience when they have thyroid disorder. So how do you know you have a thyroid disorder? Well, chances are you may have one of those symptoms or more, and you'll probably complain to your medical doctor that you're not feeling that good and that you're tired all the time and you've been gaining some weight and your hair's falling out. So what the doctor at that point will probably do will be to run some lab tests, including a TSH. And when he gets the lab tests back, if the TSH comes back out of the reference range, chances are he's going to say you have thyroid disease, and he'll probably, or she will probably, put you on medication. There's more to the story. The problem is that of all the thyroid disorders, 90% in the United States have an autoimmune component. So 90% of people who have thyroid problems will have an autoimmune disease. And simply staying on thyroid medication will just get your TSH into a normal range. But the problem is, it's not doing anything for the underlying autoimmune disorder that's slowly eating away and deteriorating your thyroid gland even more. And typically we see that with Hashimoto's disease, where the immune system continues to attack the thyroid gland. And although you get your thyroid tested by your primary care doc or your endocrinologist, the only thing that they seem to be concerned about is making sure that that TSH is within a normal range. Now, I like to use the analogy of a fire in your home. So if there's a fire going on in your home, if you just shut the fire alarm off, it'll quiet the noise, but the fire is still going, and it's going to eventually destroy the inside of your house. Now the same holds true with thyroid disease and TSH levels. If you only make sure the TSH is within a normal reference range by taking the medication, and you're not checking the underlying autoimmune disorder, then if you're not treating the autoimmune disorder, the medication is just quieting the TSH, but it's not doing anything to help the further destruction of the thyroid gland. So what do? Well, the first thing you want to do is find out if you have a thyroid disease or not, and you want to run a few lab tests. So the lab tests that you might want to ask your doctor to run are a TSH, a T4, a T3, a free T4, and a free T3. And those tests alone will be enough to tell you if you have a hypo or a hyperthyroid. And if you do, then the next step is we want to run a couple of more tests to make sure that we don't have an autoimmune disease present. And we want to run what's called a thyroid peroxidase and an antithyroglobulin. Now these two tests will let us know that if you have a thyroid problem, let's say you were hypothyroid, and those two antibodies came back positive, then you'd have Hashimoto's disease. And then that might warrant different therapy. Now, the only therapy, again, that you'll probably get would be a prescription medication to, to bring that TSH level down. And once you're diagnosed, those tests will probably never be run again, the TPO and the antithyroglobulin. So in my practice, I do things a little different. In the beginning, I not only run the TSH, the free T3, the free T4, the T3, the T4, but I also include in that panel a thyroid peroxidase and an antithyroglobulin. Just to, if you do have a thyroid problem, we want to get it all done in one shot. We want to make sure that you have a thyroid problem and you have an autoimmune disease, or you don't have a thyroid problem and you don't have an autoimmune disease. So I kind of like to get the whole thing done in one blood test. And the trick is, for those of you who have thyroid disease, or if you come back positive for thyroid disorder, is you want to run other tests to actually manage the autoimmune portion of the thyroid. And those tests are called a CD4 to a CD8 ratio, a cytokine panel, a serum vitamin D, and a high sensitivity CRP. So by running those other block of tests, we can actually manage the immune system portion of it. So we can get the thyroid under control and also manage the immune system, so the whole body system is actually in balance now. And that's essentially what we're trying to go for, complete balance of the body. So thanks for viewing my video. I hope you got a lot out of it. And as always, if you have thyroid issues, or you'd like to find out more about your health status in general, please feel free to give me a call. The information will be right on the end of this video. And have a great day. Thanks.